My name is Andrew. I live in Wolverhampton and have done so for 40 years. About a year ago, I was taken ill. I had a bug and lasted about a week. And afterwards, I was left with stiff legs. And the reason why I wanted to talk about this today was because I was just so delighted with the treatment I got, especially at New Cross and with the staff at New Cross. Leading up to coming to New Cross, after I had stiff legs, I ended up at the Phoenix Centre in Parkfields, where they had a look at me and decided straight away that I needed to come into hospital. New Cross is known to be very busy, and is also known not to turn patients away, not to close the departments, but to just keep going and to keep accepting patients and make the best of it. And that's what happened to me that day, because I couldn't be admitted when Parkfields rang and tried to admit me. It wasn't possible to admit me, so I just had to go to A&E and wait to be seen. As soon as I was seen, it was pretty clear that there was something seriously wrong with my legs and my nerve system, and I was admitted to New Cross. But from the first moment I arrived at New Cross, it was quite clear that whilst they have to work firefighting all the time, so they can have some sort of plan for a working day, but obviously in the health service you can't plan everything. You have to reprioritise all day as a direct reaction to what happens. So when I was admitted, it was quite clear that New Cross was firefighting as usual. And so I was admitted, and it took them about a week to diagnose what I had, which was a very rare and unusual nerve condition known as Guillain-Barré. During that week, I was very encouraged by the fact that there was no let-up, despite the fact that they were working flat out all around me. The nursing staff did everything they could to get to a satisfactory diagnosis as soon as they could. And that's exactly what happened. After a week, I got a diagnosis of Guillain-Barré, and then I had a treatment that was brought over from the States, and I was given this intense treatment for about 5 days. The whole experience at New Cross was what I wanted to talk about, because it didn't matter whether it was senior nursing staff or doctors, porters, anybody else. They all were dedicated to one thing only, that was looking after the patients. And that was so obvious from day one. Presumably there is some sort of hierarchy in the hospital, but that wasn't apparent during my stay. The priority was always the patients. And I relate what I saw happen to some of the nursing staff overnight sometimes to my own experience, because one of my hobbies is playing music. Anybody who's ever played a musical instrument in an orchestra, for example, will know that you've got to keep one eye on the music, another eye on the people around you listening to what they're doing, another eye on the conductor, and so all your senses are on the move at the same time, trying to balance and judge everything that's going on. The difference with the nursing staff, of course, is they don't have the music to follow. They have to react to what's going on around them. And it just made me think at 3 o'clock in the morning, when they were struggling to cope with everything, how much do we pay these people? We can't be paying them enough. They can't be here for the money. They have to be here for the patient care. And that was very obvious in everything. So throughout my whole stay in New Cross, which is, I think it was about 2 or 3 weeks, something like that, I was moved around sometimes at 3 o'clock in the morning without notice, because of the chief executive's idea that it was a constant open door and that they never closed the doors to anybody who was sick or needed attention. And for that reason, I had to be shifted at a moment's notice to another ward somewhere to accommodate somebody coming in. I never minded. I could have been grumpy about it, but I didn't, because I was being looked after very well. I was being cured, and I was being given the best possible attention I could. And this extended to after when I left hospital. For some weeks I had physiotherapy every day, people coming to the house to look after me, and they had the same type of medical dedication. So I just needed to express my feelings that when the chips are down, New Cross Hospital and the people in this area really do their jobs, and they cannot possibly be in it for the money. It's got to be for the patient care.